Happy Friday, everyone. Hope you're doing well. This week is Flu Vaccine Awareness Week, so we'll be talking about the flu shot and why you should consider getting it, and just what the flu shot does and who it's recommended for. I hope everyone's doing well. Hope you're enjoying this chillier day than it has been all week, and hope that you're in good spirits. Just gonna get Whitman-Walker in the room, and then we'll get started. In the interim, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. I'm a person who believes in vaccines, and I have gotten my flu vaccine shot as of like a week and change ago. I didn't have any bad symptoms to it. I personally always asked to get the dead virus shot. I don't know if they still do the live virus, but I think that's the one where you will often get a bit sick after you get the shot. So in order to kind of skip some of those post-shot symptoms, I've religiously asked for the dead virus. And I think the Walgreens that I got my shot at didn't have the live virus shot to start with, so that was really great. Thanks for joining Whitman-Walker. So my name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. And today we're going to be discussing Flu Vaccine Awareness Week. So this week marked National Influenza Vaccination Week. This year it was observed from December 5th to December 9th, so today's the last day. And according to the CDC, this week is all about reminding everyone who is 6 months and older that there's still time to get a flu vaccine. If you want to join the flu vaccine awareness conversation on social media, you can use hashtag #FightFlu and tag @CDCFlu on Twitter. So as we continue to navigate the COVID-19 pandemic, especially as wearing masks and practicing social or physical distancing are less common practices or less required common practices, there is a concern that the flu season will be especially bad this year, or a lot more significant this year. The University of Nebraska-Lincoln shares the following on how the flu vaccine works. So the flu vaccines contain elements of the dead influenza virus so that the immune system can respond to those specific proteins to make antibodies. When the immune system sees the virus in the future, so if you got sick with the flu in the future, it ramps up the antibody response to kill it quicker. So essentially, this will help you not get as sick with the flu if you were to come in contact with the virus, because your body has already been exposed to a little bit of it through the flu vaccine. So it knows how to respond. It almost has had like a trial practice run in how to respond to the flu if you were to get sick with it. So a few flu facts or things to know about who should get vaccinated. Did you know that children who are younger than 5 are at super high risk of developing serious flu symptoms if they were to get the flu? I think a lot of folks know that kids are like big germ carriers, so that's especially not great to hear, especially for the kids who are younger than 5 who might just be almost going to daycare and whatnot, but are still at home. Every year, thousands of children are hospitalized with the flu, so the flu is even more dangerous than the common cold for kids. So that's why it's super important that you consider getting children vaccinated against the flu this flu season. Additionally, according to the CDC, people living with a chronic condition like heart disease or asthma or diabetes should get vaccinated against the flu, as 9 out of 10 adults hospitalized with the flu have at least one of those underlying medical conditions or have a underlying medical condition. And if you're pregnant, getting the flu vaccine is the best way that you can protect yourself from the flu during pregnancy, and the best way that you can protect your baby after birth when they are too young to get the vaccination themselves, as the vaccine is approved for folks who are 6 months and older. There are a few kinds of flu vaccines, or a few different types. So there's a quadrivalent influenza or flu vaccine, and it's designed to protect against 4 different flu viruses, aka quadrivalent. So these flus include the 2 influenza A viruses and 2 influenza B viruses. Most commonly, the more available flu vaccines protect against 2 influenza A viruses and just 1 of the influenza B virus. So these quadrivalent flu vaccines protect against all 4 types. According to the CDC, people who are 65 years and older should get the preferred flu shot if available. That's the quadrivalent shot. And for the 2022 to 2023 flu season, there are 3 flu vaccines that are preferentially recommended for people who are 65 and older. So these are the Fluzone high-dose quadrivalent vaccine, the Flublok quadrivalent recombinant flu vaccine, and the Fluad quadrivalent adjuvanted flu vaccine. This recommendation was based on a review of available studies, which suggests that in this age group, these vaccines are potentially more effective than the standard dose of unadjuvanted or unadjuvanted flu vaccines. There is no preferential recommendation for people who are younger than 65 years old. If you're a person who has allergies, specifically people with egg allergies, you can receive any licensed recommended age-appropriate flu vaccine. People who have a history of severe egg allergy or those who have had symptoms of other than just hives after exposures to eggs should be vaccinated in a medical setting, supervised by a healthcare provider who's able to recognize and manage any severe allergic reactions. There are 2 completely egg-free flu vaccine options this year that are available, and it's the Flublok quadrivalent recombinant flu vaccine and the Flucelvax quadrivalent cell-based flu vaccine. A few things to know about the shot. Common side effects from the shot include soreness, redness, or swelling from the shot, headache, fever, nausea, and muscle aches. I definitely had soreness at my shot site, but it didn't last too long. I think maybe like a day or 2. And usually I think the symptoms tend to go away in a day or 2. So it's always important to know that if you're having any reactions to any vaccine that aren't life-threatening, these side effects just mean that the flu shot's working for your body. So your body is kind of practicing that immune response, practicing that, like what it would do if you were to get sick with the flu. GoodRx.com shares that the effectiveness of flu vaccines is different every year, but in general, the flu vaccine is about 40 to 60% effective most years. And the CDC estimated that the 2021 to 2022 flu vaccine from last year was about 35% effective overall. The vaccine seemed to be more effective in children than it was in adults. It'll be interesting to see why it was a bit lower last year. I wonder if it's any combination of like COVID vaccines or COVID pandemic or what have you. But yeah, all in all, please consider getting vaccinated. Please do your own research. Please visit cdc.gov. Please hear from other people in your lives who've got their flu vaccine. And it's especially important for kids who are under the age of 5 to get it because they get super sick. But thank you for taking some time to learn about flu vaccine awareness. Before we go, I want to just share a few reminders about HIV and STI prevention and testing services that are available through Whitman-Walker. If you're in need of an HIV or STI testing appointment, you can give Whitman-Walker a call at 202-797-4439. And definitely check the website for the most up-to-date hours and locations. And if you or your community or organization are interested in Whitman-Walker providing mobile health services in your neighborhood, you can contact mobilehealth@whitman-walker.org. And you can access HIV prevention tools like PrEP and PEP or start HIV treatment with Whitman-Walker Health at its Max Robinson Center in Anacostia or its 1525 14th Street Health Center in Logan Circle. And before we go, also I want to talk about some COVID-19 updates and also monkeypox as well. So just a few reminders, if you haven't been vaccinated already, if you have been vaccinated, congratulations. Thank you for taking that important step towards preventing yourself and your loved ones and your communities from getting sick. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask, as the vaccine is not 100% effective at preventing new cases of COVID-19. However, the vaccine is very effective at helping keep you out of the hospital with COVID, helping make sure that you don't get too sick with COVID, and helping make sure that you don't have a death related to COVID. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID vaccine available. Just give them a call at 202-207-2480. And if they are out of reach for you, or you want somewhere that's closer by to you, and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you have not been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's really important that you consider getting the vaccine and discuss COVID precautionary measures with those who are around you and be mindful of mask wearing and keeping your distance, but especially when you don't know whether a person's been vaccinated or not. And it's cold outside, which means people are inside more and are maskless more and, just in close spaces and tight together more. So COVID cases are continuing to rise a bit. There are new cases happening every day. So just be vigilant, be alert, wear your mask, and be vaccinated if you choose to. So we also have monkeypox going on. According to the CDC, there are more than 29,000 cases of monkeypox documented in the U.S. And in D.C., you can register for a monkeypox appointment at preventmonkeypox.dc.gov. Virginia has been working with local care providers to contact, trace, and identify those who are most in need of a monkeypox vaccine. And in Maryland, you can visit the Maryland Health Department website for registering for a vaccine appointment with their pre-registration system. No matter where you are, you can visit your local health department's website to see more information about what they're doing to combat monkeypox and how you can access a vaccine. DC's monkeypox vaccination locations change and vary by location and hour each day. So definitely you want to visit preventmonkeypox.dc.gov and just know that vaccinations are provided on a first come first serve basis for folks who are eligible to be vaccinated and who are residents of DC. Please remember to follow the Whitman-Walker family on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website at www.whitman-walker.org for the most up-to-date information on their services. And for more COVID-19 resources and general Whitman-Walker services, please call them at 202-797-4439. You can also follow some of their programs and Whitman-Walker family at RealTalkDC_ and at NoFilterDC. Thanks so much for your time and have a wonderful rest of your Friday. Bye.